Stephanie Staples from Your Life Unlimited, and as always, trying to give you some information to help you make life a little bit better. And one of the things that we can do today is to educate ourselves about a common but little talked about issue, and that is mental health and or mental illness. The thing I want to do is bring an expert on the subject, and I'd like to introduce you today to John Melnick, who is a mental health advocate. I'm not sure, John, what's even the proper way? Is it mental health or mental illness? I'm not even sure.
Well, I think we have to start from the perspective that mental illness is so damaging and so fixable. So you have to talk about mental illness, and then you have to quickly get into mental health. How do we go from mental illness to mental health?
Okay.
I think that's very important. Yeah.
And you have a specific place that you want to focus on your...
I focus on mental health in the workplace and creating mentally healthy workplaces. In Canada, every year, there are roughly 7 million people who will experience a mental health problem, and 70% of those, or 5 million of them, are in the workplace. So if we can focus on education in the workplace, we can reach 70% of the people that are having mental health issues. That's a big number.
Huge. I think a lot of us have someone in our life, in our workplace, in our home, in our family, friends, extended circles that are either suffering with this. They know about it, they don't know about it, they might even be getting treatment that we don't know about. It's there.
True.
What can we do? How can we recognize the signs?
Well, first off, to look at the signs. When people have changes in their behavior, showing up for work late, missing late work a fair bit, anxious, aggravated, or just not caring, primarily a change in their behavior, that's a good sign that there's quite likely a mental health issue of some sort going on. And if it lasts for 2 weeks or longer, that's when you should really start to pay attention to it.
So time is the key.
Very
we all
much.
have bad days.
Very, very much.
Bad few days.
Correct. And like I say, if 2 weeks and it's consistent, better take a look at it very close.
So how would you suggest we broach the subject? If it's us, okay, we need to step up, we need to go get help. If it's someone that we love, how would you gently suggest?
You know, that's a big question. And it depends on your rapport with that person and how much that person trusts you. If you have a good, honest, straightforward rapport with somebody, you just ask them straightforward, are you feeling okay? Is there something going on? You know, what might be happening? But if you're reticent to talk to somebody, there's places like the Mood Disorders Association and the Canadian Mental Health Association. On their websites, they might have some ideas where you can contact them directly and they will give you some ideas. There's ways to do this.
Good idea. So I think what we want people to know is that there is help out there.
Yes.
There are solutions.
Yes.
There are happy endings.
Yes.
Many, many happy endings. It doesn't have to be the end of the road if you are suffering from depression or any sort of mental illness.
Not at all.
Even if you suspect it.
Absolutely.
Go get help. Talk to somebody.
Early intervention, prevention is the key to stopping it from getting way out of hand, which it can very easily. Early intervention, very important.
Well, thank you for the work you do and for bringing more light to this subject that needs to be talked about. It's going to help us. It's going to help our workplaces be more healthy. It's going to help all of us be more happy. So think about what you can do. Tons of resources out there. Go out and find them. Mental health is important to all of us. I'm Stephanie Staples, as usual, encouraging you to live your life unlimited. Thanks, John.